Are you concerned about your blood sugar levels? We'll explore how high blood sugar can get before it starts causing damage to our bodies. Blood sugar, also known as glucose, is the fuel that powers our cells. But like anything else, too much of a good thing can be harmful. When we talk about high blood sugar, we're referring to a condition called hyperglycemia. When blood sugar gets too low, it is called hypoglycemia. That also could be very dangerous and fatal if action is not taken quickly. But today we are talking mainly about hyperglycemia, or too high blood sugar level in the blood. Now, you might be wondering, what's considered normal blood sugar? For most people without diabetes, fasting blood sugar levels should be between 72 and 99 milligrams per deciliter, milligram per deciliter. 2 hours after eating, levels should be up to 140 milligrams per deciliter. In some countries, we measure in millimoles per liter. In that case, people without diabetes, fasting blood sugar levels should be between 4 and 5.5. 2 hours after eating, levels should be up to 7.8. But what happens when blood sugar levels climb higher than that? Let's break it down. Wait, there is more, but do not forget to hit the like button and subscribe, down below. When blood sugar levels consistently stay above 140 milligrams per deciliter, that's when we start to see potential problems. At this point, your body might be in a state of prediabetes. It's estimated that about 9.1% of adults aged 20-79 years worldwide have impaired glucose tolerance, a condition of prediabetes. That's a staggering number. If blood sugar levels continue to rise and remain between 140 and 199 milligrams per deciliter, you're in the danger zone of developing type 2 diabetes. On a side note, it is worthwhile spending a few pennies on a blood sugar measuring machine even though you are not a diabetic. But it is not worth spending money on a smart watch, as most watches I have seen give you false readings. To be worthwhile, it has to be at least 20% accurate. At this stage, your body is struggling to use insulin effectively, a condition known as insulin resistance. Once your blood sugar levels reach 200 milligrams per deciliter or higher, that's when doctors typically diagnose diabetes. But the real damage starts much earlier. Damages occur when blood sugar levels stay consistently high above the healthy level, which is 140 milligrams per deciliter or about 8 millimoles per liter over time. So, what kind of damage are we talking about? Well, it's not pretty. High blood sugar can affect almost every part of your body. Let's take a closer look at some of the ways it can harm you. First up, your blood vessels. High blood sugar can cause your blood vessels to harden and narrow, a condition called atherosclerosis. This can lead to serious problems like heart attacks and strokes. Your kidneys take a hit too. They have to work overtime to filter out all that extra sugar in your blood. Over time, this can lead to kidney disease or even kidney failure. Your eyes aren't safe either. High blood sugar can damage the blood vessels in your retina, potentially causing vision loss or blindness. Your nerves can also suffer. Many people with long-term high blood sugar develop nerve damage or neuropathy. This can cause tingling, pain, or loss of sensation in your feet, legs, and hands. But that's not all. High blood sugar can weaken your immune system, making you more susceptible to infections. It can also cause problems with wound healing, which in severe cases could lead to amputations. Now, you might be thinking, how quickly does this damage occur? Well, it's not an overnight process. The damage from high blood sugar usually happens gradually over months or years. But that's why it's so important to catch it early and keep it under control. Let's talk about some of the early warning signs of high blood sugar. You might feel unusually thirsty and find yourself urinating more often. You could experience blurred vision, fatigue, or headaches. Some people also notice that cuts and sores take longer to heal. If blood sugar levels get really high, you might experience more severe symptoms. These can include extreme fatigue, nausea, vomiting, shortness of breath, and even confusion. In severe cases, it can lead to a life-threatening condition called diabetic ketoacidosis. But don't panic. The good news is that with proper management, you can prevent or delay many of these complications. The key is keeping your blood sugar levels as close to normal as possible. For people with diabetes, the American Diabetes Association recommends aiming for blood sugar levels between 70 to 130 milligrams per deciliter before meals, and less than 180 milligrams per deciliter after meals. But these targets can vary depending on individual factors, so it's important to work with your healthcare provider to determine what's right for you. Most of the targets are defined by the ADA or the American Diabetes Association. They get considerable funds from drug companies or companies making insulin and other medications. Some of the key corporate sponsors include Lilly Diabetes, Merck, Abbott, Dexcom, Pfizer, BD, Becton, Dickinson & Company, Sanofi. They make more money if you suffer from diabetes. Now, you might be wondering, how can I keep my blood sugar levels in check? Well, there are several strategies that can help. First and foremost, diet plays a crucial role. Eating a balanced diet with plenty of fruits, vegetables, whole grains, and lean proteins can help stabilize blood sugar levels. It's also important to watch your portion sizes and limit foods high in sugar and refined carbs. Regular exercise is another powerful tool. Physical activity helps your body use insulin more effectively, which can lower your blood sugar levels. Aim for at least 150 minutes of moderate intensity exercise per week. If you have diabetes, taking your medications as prescribed is crucial. Always ask and request to get oral medications before going into expensive and cumbersome insulin injections. If you have type 1 diabetes, there is no option other than insulin injections. But still, you can limit the required insulin injections by controlling your diet and doing more exercises. Stress management is also important. When you're stressed, your body releases hormones that can raise your blood sugar levels. Finding healthy ways to cope with stress, like meditation or yoga, can help keep your blood sugar in check. Regular monitoring is key. If you have diabetes or prediabetes, your doctor might recommend checking your blood sugar levels at home. This can help you understand how different foods, activities, and medications affect your blood sugar. It's also important to get regular checkups with your healthcare provider. They can perform tests like the A1C test, which gives a picture of your average blood sugar levels over the past 2 to 3 months. Now, let's address a common question. Can you reverse the damage caused by high blood sugar? In most cases, yes. If caught early, most of the effects of high blood sugar can be reversed with a good diet, proper treatment, and lifestyle changes. But some damage, particularly to nerves and blood vessels, may become permanent if you neglect it for too long. That's why prevention and early intervention are so crucial. So, to sum it all up, high blood sugar starts to cause damage when it consistently stays above 140 milligrams per deciliter. The higher it goes and the longer it stays elevated, the more damage it can do. But with proper management and care, you can keep your blood sugar levels in a healthy range and protect your body from harm. Remember, your health is in your hands. By understanding the risks of high blood sugar and taking steps to keep it under control, you're investing in a healthier future. So, keep an eye on those numbers, make healthy choices, and don't hesitate to reach out to your healthcare provider if you have concerns. Your body will thank you for it. Consult your healthcare professional before changing your medication or lifestyle. None of the information provided by this video is a replacement for your physician's advice.